Hi, in this video we will be talking about a very rare but very painful condition called as scar endometriosis. Okay, the scar endometriosis is a condition where the endometriosis or the endometrial gland gets implanted in the scar tissue. Mainly we are talking about cesarean scar or any laparoscopic scar where we have done any surgery for endometriosis, or sometimes even in the episiotomy, that is the where the normal delivery happens and then the cut is given in the vulva, and the endometrial gland can get implanted in that region and start growing. But as the tissue is growing inside because of the hormonal effect and it has no other place to escape, it is very painful condition. So I have Dr. Divya with me, who will also be talking about scar endometriosis. What are the causes of scar endometriosis?
The common causes include the pelvic surgeries. By closing the abdominal closure, the endometriotic tissue gets implanted in the scar site. That, as Sir said, is a common following a cesarean section, following any abdominal pelvic surgeries for adenomyosis, for myomectomy. It's very common during cesarean sections.
And also endometriosis. Okay. So when we are doing endometriotic surgery, we are very careful when you are retrieving the tissue or when the ports are moving in and out. Sometimes it so happens when you are removing an endometriotic tissue glands out, so this endometriotic thing can sit in the port and start growing. So is there any medical management for this condition? What are the medical management for this condition?
There are no specific medical management, but we have temporary measures so that we can, because of common cause of endometriosis is estrogen, so we can give anti-estrogen for a temporary measures and stop the cycles. But these are all temporary measures.
And some painkillers also can be given, but most of the medical management is temporary.
So, how common is scar endometriosis?
Scar endometriosis is not very common. I would say I would have seen somewhere around 15 to 20 cases of scar endometriosis till now. Basically, it happens as we already said, because of cesarean section. Endometrial gland gets implanted. We advise whenever we are doing a cesarean section to give a nice thorough wash when you are closing the rectus sheath and the muscle. So that can avoid or reduce the incidence of scar endometriosis. But per se, yes, it's not that 100% foolproof. When you're doing surgeries for pelvic surgeries, when you're retrieving this tissues, specifically the endometriotic tissue, make sure that we do it in an endo bag or give a nice wash if there is any spill which has happened. Yeah.
So, how do you diagnose this? When do how the patient presents with scar?
So generally we diagnose this by symptomatically. Okay, it's following, as I said, either during after the surgery or the cesarean. Usually it takes quite some time, at least around 5-6 periods should happen for the symptoms to start presenting. Surface probe has high frequency and will be able to detect anything just below the skin or up to the rectus muscle. As we know that the scar endometriosis is usually located either on the rectus sheath or on the rectus muscle, usually just below the rectus sheath and in the muscle. So it's an entrapment which we will generally get. This is one such condition. As we can see, this is the skin, fat, and you can clearly see a white line which is actually the rectus sheath, and then you have this lesion which is around 15 into 6 mm, as small as a small peanut, and this can cause so much of a havoc in the patient's personal life. Surface probe can pick up this, need to spend some time on the patient, and most of the time we find this diagnosis. Once we find this, it is easier to treat and probably even reach to the conclusion. Typical symptoms are usually a progressive pain during the period, and as the days go by or months go by, the pain starts coming even before the period, last during the periods, and after the period also. In initial stages, it is very difficult to diagnose because it's not palpable or we don't feel it. So in that case, we use the ultrasounds to diagnose, and MRI, CT scans are not much useful in this kind of a condition. But I would say scan is the most strongest modality of diagnosis.
So, what's the treatment for this, sir?
As you already said, medical management is only for the pain or a temporary relief. But the ultimate treatment option is surgical excision of the mass or the endometrioma. What we generally say is wide excision of the mass. So you can watch our surgical video in which we have demonstrated how do we identify the scar endometrioma by doing an intra-op ultrasound using a surface probe. If the mass is small, then we can use a needle to or a needle guide to mark the track, and then doing a wide excision in and around that. Make sure there is a nice fresh margin which is obtained when you're doing the scar endometrioma. Generally, the outcome of the surgery is really good. If you do a wide excision, we have, as I said, we have done almost like 15-20 cases. None of the cases have come back, or recurrence is very, very low if you do a proper excision of the scar endometrioma. One more thing which you would also need to be careful is before doing the diagnosis and treatment, do a pelvic scan, see if there is any pelvic mass or endometriosis, coexisting endometriosis, any other condition which may require your attention, because it should not be that we treat this and then we missed out on that and then that becomes more painful later. So make sure that we also do a pelvic scan to take care of any pelvic mass which is there to be removed. So the take home points are, yes, it is due to surgical condition. It is what we call it as an iatrogenic lesion. It is very painful, usually a progressive condition. Diagnosis is usually by the symptoms, and an ultrasound is more than enough to diagnose the condition. So treatment wise, yes, surgery is the final option. But before doing the surgery, also look at the pelvis to make sure that you do not miss out on any other coexisting pelvic condition. Thank you.